So my name is Janelle Friesen. I am the Public Information Officer with the Unified Government Public Health Department. And I'm here with Adrienne today. Do you want to introduce yourself?
Yeah, my name is Adrienne Showalter Matlock, and I'm the COVID-19 project manager for the health department.
All right, thanks for being on here today. We got a couple exciting things to talk about. So some new services that are available for free in Wyandotte County. There's a new option related to COVID-19 testing. Can you tell us a little bit more about that?
Yeah, I'm really excited to share that we now have COVID testing that can be brought right to your doorstep. So it's completely free, and anyone who is a resident of Wyandotte County can go to our website, ycovaccines.org, to request that a COVID test be brought to and administered right at your doorstep. So also, if you are unable to access the website or the internet, you can call 311 to request the test to be brought to you. So basically, these are saliva tests. So when you go to the website, or if you are calling in over 311, you'll provide your basic information, your name, your birth date, whether you've had symptoms or not, and your address so that they know where to come by. Then we will come to your doorstep. You'll select a time. They can come usually the next day. So you select a time frame that you'd like for them to come by. They'll come and knock on your door, and they'll have a tube for you to drool or spit into, and they'll collect the sample, take it, and you'll receive your results via text message within usually 24 hours, but 24 to 48 hours.
All right, great. Sounds like a pretty convenient way to get tested. So who should get tested for COVID-19 right now?
You know, these days, it's my mantra is it COVID or a cold? So if you are having any kind of symptoms that often may be associated with flu or cold or even allergies, that means that you should get tested for COVID. A lot of the symptoms are similar, so please make sure to get tested. Even if you're vaccinated, you should still get tested. Also, if you are traveling soon or you've just come back from travel, you may want to get tested even if you don't have any symptoms. And then ultimately, if you haven't gotten vaccinated and you've been around somebody who has COVID, you definitely need to get tested.
All right, great. I know that there has been less talk about testing now that we're in the realm of vaccines, so it's good to kind of get an update on what that means today. So I know that testing isn't the only service that people can access through the website or through 311. Can you talk a little bit about some of the other services that are available?
Yeah, absolutely. We have also the option for somebody to request food assistance if you are needing to quarantine or isolate. One of the things we know about COVID is that it spreads very readily, and so we want to help people to stay home. So if you have COVID, if you're unvaccinated and you've been exposed to someone with COVID, then we ask that you quarantine or isolate at home. And we want to make sure that that's easy for Wyandotte County residents to do. So you can go to our website or call 301 to request food to be delivered to your door to help you stay home during your quarantine. And we also have, besides testing that can come to your door, you can also request for a homebound vaccination. So if you are homebound and you're not able to leave your home, you can request for our mobile clinic to come. And then in general, if your church, your business, your organization wants for our vaccine unit to come out and conduct a vaccine clinic, you can also request that on our website, wycovaccines.org, or by calling 311.
What about if you are getting vaccinated at our sites, but you need a ride?
Yes. Oh my goodness. Thank you for mentioning that. I can't believe I forgot. Um, you can get a free ride to any of our vaccination sites. So same way, go to wycovaccines.org, click request a ride, or call 311. It is a free taxi ride, and we're very excited to be able to offer that. So we don't want for anything to stand in your way from getting vaccinated, and so transportation will help get you there. And that's not just transportation for you, but it could be if you need for your family or for your group, you can click that link to schedule a ride for yourself or for a group.
All right. And again, all of these things are available for free. So,
Yes, completely free.
all right, great. Well, thank you for going over that. Anything else before we kind of do a last little update and wrap up?
No, just reminding everybody to get tested. If you don't know if it's COVID or a cold, if you're having symptoms, get tested. Request an at-home test today. It'll be delivered to your door and administered on your doorstep tomorrow.
All right, great. So to close us out, I wanted to do a really quick update because we have some changes to our vaccine hours that start next week and go through most of June. So we will have a couple days a week at our two sites. We had three sites before, but the west site at the former Best Buy is now closed. But we still have the sites at the former Kmart and at the Armory. The Kmart site is going to be open Tuesdays and Wednesdays from 11 a.m. to 7 p.m. We wanted to make sure that both of those days were open a little bit later in the day. And then those same hours, 11 to 7, will be at the Armory, but on Thursday and Friday. And Saturdays in June, we're still working with Donnelly College, and they are providing vaccines on Saturdays at the Armory from 9 a.m. to 2:30 p.m. So those all those hours are going to be on our website. We'll have that updated as we go into next week, and then we of course still have those mobile vaccines that we mentioned as well. So because we know not everybody can come to our sites, so we want to have multiple options to get folks vaccinated. All right.
We also have expanded bus service on Saturdays for anybody who's wanting to come out to the Armory on Saturdays. There's several routes that are expanded, including the 118, the 102, and the 106.
Thank you for that. I'd forgotten to mention that. Thanks for bringing that up. Okay, well, I think that's all we have for today. Thanks, everyone. We will see you next week.
Thank you.